Welcome into To Your Health, and this is Heart Healthy Month. So in order to make this the best month you can possibly have to learn as much as you can about this old ticker, we brought in Tiffany Bass, the director of the Baptist Health System's Cardiovascular Department. And obviously, you're at Baptist South.
Correct.
But you probably do work throughout the whole system.
Absolutely.
Absolutely.
Yes.
Okay, last week
I help where I can.
Last week we found out about what's happening as we start to age with the vascular system and some different types of things. And you know, you're talking about some of the numbers, but people don't, you know, they're not constantly looking at these numbers, except for the scale, you know. But, and I know there's things like heart attack and stroke, and there are signs or symptoms that you're having a problem with your heart or your vascular system that people need to really pay attention to.
Yes.
And what would some of those be?
Well, shortness of breath.
Okay.
Especially, a lot of times we expect it at exertion, meaning if we're doing hard work, we expect to be a little short of breath. But sometimes people have shortness of breath even at rest when they're not as active, and that is always a problem. Tingling in your lower extremities, fingers, numbness in your feet, you want to be very aware of and bring those type of issues to the attention of your physician. Shortness of breath is one of the major things, and oftentimes the number one complaint of our patients that we see in our cardiovascular world. They show up and they say, I have shortness of breath when I'm active or working, and also chest pain that sometimes patients think maybe a little indigestion. But in combination of those two, we most of the time have a cardiac problem that we need to pay some attention to.
And then obviously from the heart standpoint too, they always talk about maybe you're going to get pain going down your arm.
Absolutely.
Or in your
jaw. And that differs sometimes between men and women. Men most of the time will complain of that center chest pain with the arm chest pain. Women, on the other hand, I've seen some different things. I see more of the jaw pain or neck or shoulder pain, thinking they're just a little tense and maybe need a massage, but our symptoms are sometimes very different than the traditional symptoms.
Yeah, sometimes they call it the silent killer in women. Because
yes, it is. It is.
Because men seem to present as, I guess that's the term.
Y'all present more vividly than we do.
Absolutely.
The symptoms a little more vividly.
And unfortunately, sometimes we've seen all the commercials that the first symptom is a heart attack. So that's why I always advocate for us to be more proactive than reactive, meaning that we keep up with those things that contribute to heart disease and make sure that we keep those in check, such as weight, smoking, poor diet, and sedentary lifestyle. All of those are major contributing factors to heart disease. So we want to manage those on the front end versus wait until we have a problem and trying to reverse those, if that makes sense.
Do we need to talk a little bit about stroke? Is it the same kind of a situation, or is that a whole different ball game?
It's not a whole different ball game. It's different in some perspective.
Could your heart have an effect on that? Okay.
Yes, sir. However, the contributing factors most of the time are the same, if not all the time. High blood pressure increases your risk for a stroke. Obesity increases your risk for a stroke, which all of that ties to lack of exercise and poor diet. Now, there's always the hereditary factor that sometimes we can't really control. But again, the goal is to be aware, be cognizant of your risk factors, and I don't want to forget smoking, because those are things we can change. Be aware of your risk factors and make changes to promote health.
Okay, in the case of a stroke, a lot of times slurred speech is one of the first things, or half of your head is...
You'll sometimes see drooping on one side, or slur of speech. Disorientation. See, you know all of those things. Great.
But I need to hear them from the expert here.
Absolutely.
Right. Well, that's good. So I guess we need to let our viewers know that obviously, first and foremost, any sign that something's wrong needs to be not treated lightly.
Yes.
Needs to be treated seriously.
Absolutely.
Especially if you happen to be living by yourself. If you're on your own, don't think this is going to go away. At least if you're starting to feel something like that, let somebody know so that they can, if for some reason we haven't heard from this person in a couple of hours, we know that maybe something's going on and somebody can kind of check on them.
Absolutely. And for heart health, especially, if I can't leave with any other message, any type of chest pain can potentially be a heart attack. Don't mistake it for indigestion.
Right.
We much rather rule out a cardiac event than to have you at home and be in the middle of a heart attack without help. Oftentimes we have, especially our women will present after days of having chest pain, thinking that they have had indigestion for several days. Come in, let us check you out. If you're fine, we'll send you back, but we can definitely help you if we can get you in to be seen
I have
quickly.
a quick question to differentiate between the indigestion and the chest pain. If you take Malox or whatever and that eliminates that pain, does that tell you anything?
Well, it possibly, you can have a slight decrease in the pain, and that's the thing that's tricky, because sometimes patients feel better, but there is still a cardiac event happening. So I would say this: if you have persistent chest pain, even if you take something and you think it's heartburn or indigestion, but it returns relatively quickly, let someone check you out, because sometimes, again, we've had patients that have taken antacids for multiple days before they present. So I would just move cautiously with that and make sure that you have some follow-up if it continues.
Good. Thank you. We're going to give you to come back next week, and next week we're going to talk to people about if you do have these problems, how do we treat them, okay? And just remember this, it's your heart. Keep it as healthy as you can, and we'll be right back.